I'm excited to be joined by Dr. Abdul El Sayed. He's a doctor, epidemiologist, progressive educator, author of Healing Politics and Medicare for All, a citizen's guide, and the host of America Dissected, a podcast from Crooked Media. And he's also the writer of a Substack called incision.substack.com. Dr. Sayed, thank you so much for joining me.
Ben, thank you so much for having me here today.
It's a pleasure. I want to start with, I want to start with something that you said. There's a lot for us to talk about, but I want to start with what you said on Twitter about vaccines. This is what you said. Don't get me wrong. Vaccines are the most powerful tool in our public health arsenal right now, but they are not and were never the tool. Instead, vaccines are one tool among many that must be used together to bring this pandemic to its end. And the reason I want to start there is because in our communities, communities of color, particularly the Black community, like we have an aversion to the idea of taking vaccines in the first place. Right. One of the number one arguments that I have with some family members and definitely a whole lot of friends is whether or not we should take this vaccine. There's a broader conversation to be had. But once you tweeted that and once you stated that, I felt like we should discuss that portion of it. What are your thoughts with regard to the vaccine and the fear that's present in a lot of communities of color, particularly because we have justified fear because of the history of this country? How do we overcome that to use it as the tool that you say that it is?
Yeah, Ben, let me tell you, I used to be the health commissioner in the city of Detroit, and my job in the largest majority Black city in the country was to empower people to make the best choices when it came to their health. I believe deeply that vaccines are part of that choice. And the reason why is because they've had a huge success in saving lives, particularly when it comes to diseases that disproportionately affect Black and brown people. That said, we have to acknowledge the fact that we can't just sit here and say, trust the science, as if the science hasn't exploited Black folks throughout the history of this country, just like every other major establishment has. And so when I say that from a position of empathy and respect for acknowledging that history and also speaking to the work that has been done to try and address that. I believe deeply that the role of science, the fundamental core of science, is skepticism. So people who are being skeptical are doing the thing that we do in science all the time. But the antidote to skepticism in science is data. And when you look at this data, it shows that this vaccine is safe and effective. In fact, I had the privilege of speaking to one of the lead scientists who helped to create the Moderna vaccine. Her name is Dr. Kizzmekia Corbett. And we had a conversation specifically about the mistrust of these vaccines and where that comes from. And she said, look, at the end of the day, we have to acknowledge the fact that people who look like me, and she's a Black woman, young Black woman, were in rooms in the past when we were making decisions about these vaccines. And they are now. In fact, she was one of the lead researchers who helped develop that vaccine. And I asked her, what's your message to Black folks who are looking at this and saying, this was created in less than a year. I don't know how they did that when the fastest they've ever done it in the past was 4 years. Tell me why you think I should take this. And she said, look, at the end of the day, this virus has taken 2 to 3 times as many Black lives per capita as it has white lives. And that's just lives. Now, when we talk about livelihoods, the impact that it has had on majority Black communities, like the one that I used to be responsible for, is unspeakable. And we have a responsibility to protect our own. And when she was talking about her work, she said, look, I'm doing my work out of love for my own community. And that was really powerful to me. But I hear folks when they say, look, I'm skeptical, I need more proof. And my point is to say, look, I hear you, and it's good to have that skepticism. But you can't let your cousins post on Facebook or your friends thing on Instagram stand in the way of you getting active, true information from the folks who are on the front lines. And so I encourage everybody to get that vaccine. Do your reading, really do your reading. You can go right to those government websites where they've shown all the data about the vaccine. But in the end, it is critical that we bring this pandemic to an end, because we know that the short-term side effects of this pandemic have meant many people dying, nearly 500,000 people dying, and the long-term consequences we're still starting to understand. And so if it's between that or a vaccine whose data shows that it is both safe and very effective, I'll pick the vaccine every day. Both me and my wife have been vaccinated, and that's because we've been able to look at that science and have that conversation for ourselves. And so I hope that folks will do the same. But I hear you on that skepticism. And look, we've got to speak directly to that history and the work that we need to do to address it so that folks can really trust that science when we talk about it.
I want to ask just a question from just a health perspective. A lot of these people who are talking about getting the coronavirus and getting over it, because so many people have. Can you speak quickly to the long-term effects of having COVID-19? Because I know people who've had COVID-19 and are not fully healthy right now and are still struggling with the after effects of what COVID did to their lungs. And it's not something you just are guaranteed to just pop through and get over.
Yeah, that's right, Ida. And I really appreciate you bringing up that question. We know that about 30 to 35% who are going to be infected with COVID-19 will end up being what we call long haulers, meaning that they've got symptoms well into the future after the first symptoms and the first infection has subsided. And that's because this virus does some really odd things in a number of parts of your body. And people think that, well, I'm going to get over it and I'll be immune, and that was that. But no, you're not really certain that you're going to actually fully get over it, that you're not going to have symptoms that last months afterwards. And then the second point is that this virus has the ability to evolve and to evolve very quickly. And right now we're talking about these variants that have evolved in different parts of the world that are spreading a lot faster. And some of these variants, our science suggests, are actually resistant to our body's natural immunity that you pick up after having been infected by the original version of the coronavirus. And so, the assumption that you're making that I'll be okay after I get over it, that's not a good assumption to make because it's just not true. And then the other assumption that you'll make that, I'll be immune after I got the virus is also just not true. And so the key thing that we have to do right now is to protect ourselves from this infection. And the best single way to do that right now, aside from doing the obvious things like wearing masks and physically distancing and following those protocols, is to get a vaccine. And so, to me, I just try and take this really rationally, which is you're thinking about a set of trade-offs, costs and benefits. And the costs of the coronavirus vaccine are very low and the benefits are very high, whereas the costs of getting the virus itself are very high. And the benefits are nothing. So to me, it's an obvious trade-off.
Let me follow up with what you were saying on your Substack. Again, your Substack is incision.substack.com, and encourage everyone to go and subscribe to it so that you can get this kind of information. So you've taken the vaccine. And you understand the suspicion that communities of color, particularly Black folks, we have a long history of this country taking advantage of us, using science to vilify us in some ways. But you understand that suspicion. And I love the way you justified it. You said skepticism is a key tenet of the scientific process, right? But the resolution to that skepticism has to be the data. I appreciate that. You said on your Substack that vaccines are not the only tool in ending this. And I'm wondering what other tools did you have in mind? Because we just got done with a conversation about collectivism versus the individualism in this country. And I feel like one of the biggest things that we could have done was simply wear a mask and self-quarantine and stay at home, those type of things. Is that what are you referencing that, or is there a whole nother set of tools that we should also be aware of?
No, Ben, that's exactly right. Look, our public health infrastructure, and for reasons that have everything to do with corporate profits in the healthcare industry, our public health infrastructure was anemic at best when the coronavirus hit. And we were unable to do those basic collective things like wear a mask because it's better for me and the people around me, or maybe forego that extra engagement with someone or that visit to someone's house because, well, we've got a really active viral pandemic going on. Those kinds of collective interventions are critical. And what we're seeing right now is that, thankfully, cases are on the decline, hospitalizations are on the decline, and deaths are on the decline. But the problem with it is that less coronavirus is not the same as no coronavirus. And so what we're seeing is that governors are taking this opportunity to ease some of the restrictions that they put down that were so critical to bringing this virus transmission down in the first place. And the problem with that, right, is that you may think that you've beaten coronavirus because the numbers are looking good, but all we're doing is giving it more oxygen to come back. And particularly when we have these variants, I'm really worried about what that means. And so, yes, we've got to work really hard to get everybody vaccinated. But that doesn't mean that we give up on all of the other things that we know work to prevent coronavirus. And so we've got to be thinking about these vaccines as one tool among many tools to beat this pandemic. And we can't be giving up on the ones that we know work because the vaccine is, quote unquote, on its way. And I'm really worried about what the impact might be if we give this virus more oxygen, more room to exploit our unwillingness to keep pressing on with the basic collective public health interventions that admittedly in this country, we just haven't been very good at from the very beginning.
And this connects directly to your work because you're a fierce advocate for Medicare for all. And as you speak on the fragility of our infrastructure here, our medical infrastructure, speak to your efforts to push for Medicare for all, because I think that's something we all agree on, that in a country as wealthy as America, like it only makes sense that we would have a healthcare industry that is not driven by profits.
You know, I went to medical school because I believed that it was critical to learning how to heal. You know, for me, I grew up just outside Detroit, but my parents are immigrants from Egypt. And so I could travel 15 hours and get to Alexandria, where I'd hang out with my grandparents, my aunts and uncles, my cousins. My grandmother, she's a victim of the kind of inattention and lack of investment that we've made in so many parts of the world that have been colonized. She never got to go to school despite being the smartest, wisest person I've ever met in my life. She lost 2 of her babies before the age of 1. Now, here's the crazy thing. In 15 hours, I traveled 10 years difference in life expectancy. I could go 15 minutes south into the city of Detroit and go to a community where the life expectancy was more similar to Egypt than it was to the county in which I was growing up. And that to me was astounding. I went to medical school because I thought that learning how to be a doctor was going to help me to heal that, except for I saw up front and center that the healthcare system itself was part of the problem. The way that we treat low-income people, the way we treat Black people, the way that we excuse implicit and explicit bias in our system, the way that we commodify people's bodies is everything that's wrong with healthcare in our country. And we've seen the consequences of it firsthand when it came to this pandemic. I've been working on health reform for a long time now. I had the privilege of running for governor of Michigan. I ran on a single payer platform. I was a national surrogate for Bernie Sanders, mostly focused on Medicare for all. When we were building the Democratic platform, I was appointed by Senator Sanders as one of 8 delegates to the Biden-Sanders task force on healthcare. And I had the privilege of carrying the Medicare for all amendment to the platform, though it got denied in the platform committee at this DNC. I've recently written a book with my co-author, Dr. Micah Johnson, called Medicare for All, A Citizen's Guide. And here's the reason why. Because if we want to understand why in this country we systematically and consistently fail to protect the bodies of low-income people, of Black people, then we have to understand the way that racism and poverty have intertwined themselves into our healthcare system. And the way that we assume that healthcare being a business is the way to go has systematically excluded these folks who need healthcare most and extracted from the rest of us. We spend 18 cents per dollar of every dollar spent in our entire economy on healthcare. And for that, we get middling to poor health outcomes. And that's because we do not invest in everybody the same way. And if we believe that healthcare is a human right, that's not just lip service. That means that no matter who you are, where you are, who your parents are, the color of your skin, how you pray, who you love, that you should have access to healthcare if and when you get sick in your community, and that healthcare should be worth the same as the healthcare provided to anybody else. And so this is about a right that we decide to invest in people. And then it's about all of the downstream consequences of doing that thing, which are that when the government is responsible for paying for your health insurance, then it takes a huge stake in making sure that you stay healthy in the first place because it doesn't want to have to pay those dollars in the back end. But we don't do that in this country. And it's part of the reason why COVID-19 has been so damaging in our country relative to other countries. And I'll leave you with a stat on this. We account for 4% of the entire world's population and 23% of all COVID-19 deaths. We have 5 times the global average of deaths per capita to COVID-19. And that's not because we don't have money. That's not because we don't have power. That's because we are unwilling to invest in the collective and do the basic thing that every other high-income country in the world has done.
You know, I wanted to ask, because when we have the Medicare for all conversation, capitalism's one of its greatest tricks is to convince poor people and working class people that they too can be billionaires. So they fight for that right. And so they bite their noses to spite their faces. One of the biggest arguments that I'm always faced with when I talk about Medicare for all is how it's going to affect insurance and the people who already have insurance, and they don't want the quality of their healthcare to decline because now they have to share with everybody else, and blah, 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 all the talking points that the dummies always give you when they've been mind tricked into believing that they're going to be Elon Musk one day. So what is it that you can say, because you are a doctor, and a lot of people say the doctors are going to suffer when they do this. How do you address these talking points with people from where you stand, because you stand at the nucleus of it all, right. And probably can empower us into being able to have these conversations with people when they tell us these things?
Yeah, well, I appreciate that folks right now are worried about things getting worse. My first book, Healing Politics, was about an epidemic of insecurity. And the thing that insecurity does to you is tells you that things can't get better. It's always just going to get worse. And so when we come out and say, look, our system is so bad that here are the things we could have, it almost sounds too good to be true. And folks go back to their insecurity and say, well, there's no way that what you're selling me isn't just a bucket of lies, and it's not going to work out. But here's the thing. The health insurance industry exists as it stands because it is so bad that everything we say about how we could fix it sounds too good to be true. And then they spend millions of dollars both lobbying politicians to say the same things and or spending millions more to advertise to us, to fearmonger about how we would lose our choice, about how it was going to cost too much, about how it would ration healthcare. Here's the thing. These health insurers are doing exactly that. 15 cents on the dollar for every dollar spent in healthcare goes to overhead to the insurance company. Their CEOs are making tens of millions of dollars, while tens of millions of people are losing health insurance because we're the only country in the world that conditions getting health insurance on being employed. And at the same time, right, they're rationing our care. You know, if you've ever used your health insurance, right, if you have the poor fortune of having private health insurance and then getting sick, you know that they're trying to ration you because you have to fight for every dollar of care you already paid for. And then they invent these things like deductibles, which nobody knows what that means, or copays, which nobody knows what that means, which are ways for the insurance industry to take insurance on their own profit by making sure that you're going to have to pay extra if you actually get sick to use the care. And so they're telling you what doctors you can see, how much healthcare you can get, and meanwhile telling you that any change in the system would actually benefit, would hurt you rather than benefit you. And so, you know, the last point that you asked about doctors, look, the median doctor today supports single payer healthcare. You know why? Because it used to be back in the day that as a doctor, you could own your own business. You could start your own practice, graduate residency, and you're good to go. Now, right, because of the ways that major healthcare corporations are able to negotiate with each other, they squeeze out the smaller guy. And so you cannot compete because the prices for care that you can get because you're a small owner versus the big hospital down the street are so low that you're stuck working for them anyway. So you're making less money over the course of your life. And so doctors are realizing that they're no longer the owners of the healthcare system, not at all. Instead, you've got a bunch of CEOs with MBAs making tens of millions of dollars off your labor. And that's what's happened now.
We are speaking with Dr. Abdul El-Sayed. And I want everyone who's watching and listening to go to incision.substack.com to follow you, because what you're saying here is so critical to the conversation. I have two more questions for you. The first one is this. How do we simply convey? I think the problem is with us, the people who are on the receiving end of this neglect on behalf of our government and on behalf of capitalism driving our medical system. Because for me, it's really simple. It should be completely unacceptable for people to make profits off of the suffering of other people, right? The fact that there are middlemen in this conversation in the first place and shareholders in the middle of this in the first place, and the profit motive when we're dealing with people who are struggling with COVID, we're dealing with people who are struggling with cancer, right? We're dealing with people who are struggling with diabetes, HIV, leukemia, like just like we're talking about an entire industry that has the greed of humanity at the center, profiting off of people who are dealing with the most painful times of their lives. It's a twofold question. One, how do we get that message across? Because I think it's anathema. I think it's just completely disgusting that this is a reality in this country. But two, what does it say about like how do we change the minds of the people to not accept this kind of BS?
Yeah, well, the hard part of this, right, is that we are in a moment in our country where for the past 40 years, we have watched as all of the major public goods that government is supposed to offer us in a high income society have been pawned off to major corporations for the exclusion of the poorest and the extraction of everyone else. And when you offer public goods as a for-profit enterprise, this is a necessary outcome because people are trying to make money. So if you don't have enough money to give them, you're going to be excluded. And for everyone else, they're going to pull as much money out of you as they can. And we've got to show folks the context of this, that it doesn't actually have to be this way. But the other point is this. The point is being made every single day. Every day, somebody's denied their care from the insurance company. Every day that they have to go into bankruptcy because they have to pay their deductible. Every day they're told they can't see the doctor of their choice. The argument is already being made. What we have to do is two things. Number one, we cannot give up on a future where this is the case, right? We look at this and say, well, Senator Sanders ran twice and he didn't get elected, so it's impossible. No, that's exactly what they want you to think. The second is we have to create spaces for people to organize around this issue. We have to invest in those spaces and people have to come together around it. Whether it is doctors coming together to finally unionize as the labor that they really are, or it's everyday folks who are being hit by the system coming together to organize together in their local communities to hold their politicians accountable. We have a whole chapter in our book, Medicare for All Citizens Guide, called Organizing versus Advertising. Because in the end, look, the industry is always going to have more money, right? They spent here's a crazy thing, $151 million in 2020 alone to make sure that instead of actually doing more to invest in public healthcare, that instead, right, any relief package was going to just hand off money to them to keep people insured, which the insurance companies could have done in the first place. Because by the way, they made bumper profits during the pandemic for a bunch of different reasons. And I wrote about this in the incision. And so the thing we have to remember is that our anger and rage cannot be alone. We have to do it together, right? Because if we do it together, we can focus it in on the kind of change that actually does create a world where this kind of thing doesn't happen in the future. The last point I want to make is that the number one barrier in our country to Medicare for All and to a number of other public goods is racism. In fact, Heather McGhee, my good friend, just published a book today called The Sum of Us and talks about the way that racism interferes with our ability to invest in public goods. Because, of course, as Ida made that fantastic point, right, people see themselves as a country of future millionaires, and they think of themselves as investing into a system to pay for public goods, quote unquote, for people like them. Right. And the problem, right, with that attitude where we are unwilling to invest in one another writ large as humans, right, and the racism that's implicit in talking about people like us, that keeps us from being able to invest in these broad public goods like Medicare for All. And I'll remind you just our history, and we talk about this in the book, right? Medicare, the biggest stumbling block to getting Medicare done was that Southerners kept fear-mongering that Medicare would force a desegregation of the hospitals, which of course should have happened in the first place, right? But it did, and it actually did desegregate hospitals, which is a really good thing. But that racism was used as a tool to try and impede Medicare itself. And so we've got to see this thing playing out. We've got to take it on. We've got to call it out. And we've got to be willing as a country to make the investment that benefits all of us.
All right, I want you to get in there with a couple of other questions here.
No, I just, it's interesting. Every time I speak to other progressives, I always feel like I walk away knowing more. I learned something because I think that the ability, when we have these conversations in this country and we talk about immigrants, I'm the child of two different types of people who came to this country. And we don't realize the effects that all of this false information that upholds toxic capitalism in this country continues to plague us and impede us of our own progress. And so when we talk about racism, and we talk about racism every day because racism lives every day, it is important to understand how it functions and how all of these things, from the healthcare system to the education system to Wall Street, how all of them are super, super rich at the expense of our ignorance and at the expense of us. And so, I want to be able to help in the way that I can. So for me, when it comes to talking about Medicare for all, and I go into the communities and I talk to the people, because honestly, that's where you do your real advocacy is not on Twitter. Being able to explain to people what I wanted to ask you, because you worked in Detroit. When we come to these communities that are impoverished, where the education system is subpar and people don't have access to the information, how do we what are some of the ways and resources that we can give to the people so that they can be informed on who to vote for in their communities? Because people in affluent communities know exactly who they're going to vote for, the people that are going to protect their property and their taxes. But when it comes to our communities, we don't know, because so many of these politicians are negotiable. And Medicare for all is so important, because when we talk about the healthcare system, and the pandemic exposed the ugliness of it in this country and how it affects, our communities. What are some of the resources that we can use to help people understand why it's important to really find out these politicians who are not working or misappropriating funds on their behalf?
Yeah, that's a really, really important point, Ida. I'll say a couple of things about that. Number one, I often think that folks have it so hard. I mean, the consequences of racism, they rob you of so many of the dignities and the opportunities that when you and people like you, because of the nature of our segregation, face the same experience, it leaves you thinking this is just how life is. And unfortunately, right, that's the thing, is that it's not how life is. It's just life is for a group of people who've been systematically marginalized and oppressed out of basic access to the resources that so many other people take for granted. And the thing we have to be able to do is be better at helping people connect their lived experience to the system that created that lived experience, right? Because people, it's not necessarily that people need information. It's just that people have that experience, and our job is to connect that experience to that information. And I think when folks see that and they can map the things that they have to go through every single day to the choices that are made by powerful people in spite of them, I think it makes the work clear and obvious. And then we have to have a very clear place where folks can go to become a part of that work, right? And become a part of that organizing, even if it's just 5, 10, 15 minutes a day, right? Being able to be a part of the movement to build power on behalf of Black and Brown communities in this country. The second point is the point that you made about politicians, which is a really important one, right? And unfortunately, a lot of the mistake has actually been on the part of the progressive movement. I hear all the time that you can't organize in lower income communities and Black communities, and this is usually said by well-meaning, if completely mistaken, white progressives. And I just think it's important for us to call out the way that racism sometimes it wraps itself around our most benevolent aims. And so, that point, I think, is a really important one. And we have to be invested in organizing long-term in Black and Brown communities, because, we have a responsibility as a movement, right, to be bringing everyone along, rather than saying, well, because of our own biases or our own assumptions about people's values and opportunities, that we are going to go completely forego that. And I see that, across the country. Unfortunately, it happens right here in Michigan. And so, the progressive movement collectively has to be real thoughtful about the way that racism plays out in the kind of decisions that we make about advocating for people. Because in the end, if we don't center the people who suffer most from the system that we're trying to change and revolutionize, then we're failing the point.
Dr. Abdul El Sayed, thank you so much for joining us. And I do want to just say again, everyone who is watching or listening, I want you to go to incision.substack.com and register for his Substack so that you can continue to get this wonderful information. And we appreciate your time this morning.
Hey, thank you so much for having me. And I really appreciate a great conversation.